Well, the strike started this morning at exactly 8 in the morning, although some doctors actually turned away from their offices beginning midnight, and so they have not been seen, although this morning some of them called a press conference to just explain why they had decided to down their tools. They said that the government has neglected them. Most of them have had to improvise the personal protective equipment. Others have had to just use sometimes two masks. There's those who told us that sometimes they use two face masks so that then they can be able to protect themselves from contracting COVID-19. Others said that the quality of the personal protective equipment that they have been given has been very low quality. And they said in this, some of them have actually contracted COVID-19 and others have lost their lives. They spoke about two particular doctors who lost their lives this week. And so they were saying that they are disappointed that the government has actually, according to them, neglected them completely. But they also said that in most of the counties, because now health is no longer a central government function, it is by the counties. Most of the counties have not paid the doctors their salaries from May of this month.
All right, so what has the response been?
May of this year, sorry.
All right, what has the response been from the Department of Health, as they have said themselves that about 16 healthcare workers have died from COVID-19?
Well, it's interesting. Earlier, during press conferences that have been held by the Ministry of Health, Cabinet Secretary in charge of Health, Mutahi Kagwe, has been seen to lay blame on health workers, saying that they are the ones who have not been able to adhere to the guidelines set by the Ministry of Health, and that they are the ones who have sometimes infected their patients with COVID-19. He actually went as far as to say some of them have been careless. But when you speak to the doctors, they say that in most cases, they do not have enough equipment. They also say that even when they contract COVID-19, they cannot afford the same services that they offer their patients because their medical insurance schemes have expired and the government has not renewed those. And so most of them are actually having to either dig deep into their pockets to get money to get treatment, or their friends in the profession have had to raise money to be able to offer them treatment.
All right. So seeing that it's their word against that of government, Sarah, what's likely to happen now with this situation?
Well, it seems there is going to be a stalemate, and patients, whether those are suffering from COVID-19 or just anybody seeking health services from public hospitals, will have to suffer for some time. Either they will have to do with not having those services, or if they do not need specialized treatment, they will receive that treatment from nurses, because there are still nurses who are operating in these county hospitals. Or the other alternative is to go to the private hospitals, which are very expensive and out of reach for many of the people in Kenya, and especially in Nairobi County, where the cost of living has gone up and most people have lost their livelihoods. But also, maybe interesting to note is that this afternoon, the Nairobi Metropolitan Services, that is the department in charge of health in the county, has called on the doctors to come back to the negotiating table, but it is also asking them, even as they consider going back for talks, that they must go back to work. So they're saying one of the conditionalities of resuming talks with the doctors is for them to get back to the hospitals. Yesterday, talks between the two, that is the doctors and the Nairobi Metropolitan Services, collapsed, and that's how we found ourselves at this point. It is not only Nairobi that is on strike. We have 3 other counties in the west of the country where doctors have also downed their tools, also over the same grievances as those of Nairobi County. We understand that other counties may joining in solidarity with the doctors, and if this happens, then we are likely to have a case of paralysis in the health sector like we saw in 2017.
And the reality is, when this happens, Sarah, it's your ordinary people on the ground who will have to bear the brunt of the stalemate between government and the healthcare workers.
Yes, indeed. And when we spoke to the doctors from the day they announced that they were going to go on strike, we actually asked them about the fact that they have taken an oath of service, that they have taken an oath to continue serving even under very difficult circumstances. But they have given examples of cases where they know that the country has received money, whether from the exchequer or whether from donors, to be able to fund activities and treatments around COVID-19. But that money has actually ended up being squandered or being in the pockets of just a few enriching themselves. And so they say they cannot continue acting as what they're calling martyrs, and saying that in all this, doctors have been left out, whether it is in decision making on where isolation facilities should be, where treatment centers should be. All decision making activities around this time, they have been left out. And so they're saying even as they try to sit down and talk to the government, they say they have been doing it behind the scenes for some time now. The government has completely ignored them, and now they're left with no choice but to down their tools. The government, on the other hand, says this is a time for everybody to sacrifice, everybody to give of themselves. But they are saying that the doctors also saying that this is almost like a case of taking a soldier to the front line and not giving them a gun. And so that's how they're ending up in hospital beds or in coffins 6 feet under. As we speak, 16 healthcare workers across Kenya have died following having contracted COVID-19. More than 800 of them have actually contracted the disease.
Sarah, we'll leave it at this. We'll see what comes out of those negotiations, if they will indeed take off. Our East Africa correspondent there, Sarah Kimani, joining us, talking to us about a strike by healthcare workers in Kenya.